You know, getting older doesn't mean you have to lose your hair, not with all the advancements in technology. If you've noticed your hair is thinning, the doctors at Destin Plastic Surgery offer a procedure to replace it. Of course, you're probably wondering if it actually works. Dr. Ennis, the big question is, does it really work? Does the hair actually grow like real hair?
Absolutely, absolutely. It's your hair.
Yeah.
So when we do hair transplants, we're actually taking the person's own hair and replacing what's lost. So there's really kind of two sides to things. We have the medical side of management of hair loss, and we have the surgical side. With the medical management, what really the goal is to preserve what's there. So the gentleman comes in, just starting to notice a little thinness in the hair, and the first thing we want to do is to get them started on medical programs such as Propecia or Rogaine, because what that's going to do is that's going to help salvage and maintain all the hair that they have.
And you said gentlemen, ladies too.
Absolutely, absolutely. Now, it's a little bit different process in women because women, although they can have thin hair, typically it's a little bit different process because it's not always the testosterone that's causing the hair loss. It could be the thyroid hormone, it could be some other things. So the first thing we'll do with women is always do a good thorough hormone workup to make sure there's not some other cause of the hair loss. But if it turns out it's just normal hair loss, then and they have a good donor site, meaning they have a good hair in the back, then absolutely we can replace that hair, and it works very, very well in women. Now this lady you can see has some black dye on her scalp in order to make her hair look thicker. However, you can see this right through her scalp. This is a year out now. We've replaced that hair, and you can see she's got a nice full thick head of hair.
Where does the hair come from? Does it come from the hair in the back?
Yep. So what we found is that there's two different kinds of hair. The hair that's on top of our head and the hair that's on the back. In men, the hair that's on top of our head is genetically programmed to fall out in some men. We also know that the hair on the back of our head is not sensitive to testosterone, so we can borrow that hair and actually cut it up in individual little hairs and put that back on the top of the head, and it grows.
Once you move from the back of the head to the top of the head,
Correct.
Is that going to fall out after some time, or it just keeps growing?
No, because this hair back here is not sensitive to the precursors of the testosterone.
Even when you move it?
Yep, exactly. Now there's two ways we can do hair replacement. Once somebody comes in, for instance, if somebody comes in and they have a focal area like this where they've lost some hair, then what we're going to do is we're going to take some hair off the back of their head and we're going to put them back in there one hair at a time so it looks very natural. It's like planting seeds. It's not instant gratification like some things we do like breast implants and tummy tucks and facelifts. You wake up and everything's better. With hair transplants it takes a little while because we're planting these seeds in there and we got to wait for them to grow. Here you can see this has been about 3 months. The hair is starting to grow back in, and by a year that hair is all grown back in. It used to be the traditional strip method where we had to take a strip of hair off the back of your head. So covered very nicely as long as you had hair. There's some guys that's like, I think I want hair. They could do a hair transplant 10, 15 years later. They decide they want to shave their head. Well, they still get a scar back there. So they were always reluctant to shave their head because it was a scar from back 10, 15 years ago when they did the hair transplant. So even a guy like this, you can see, let me show you this picture. He was quite thin here at the top. So we've replaced all that. This is about 8 or 9 months out, and you can see that hair is growing back in very nicely. But the nice part about it, if you look up close, these are individual little hairs that have been put back in so that it's filled back in very nicely.
Now, how is your procedure different from other methods that we may see commercials for?
Well, that's the biggest difference now is how we harvest the hair. Now we can take them out one at a time. The hairs, most of the transplant companies, what they're doing is they're taking that big strip of hair out. So you end up with a scar, which is really unnecessary at this point.
Oh yeah, you don't want the scar.
No.
You're going to go do it right?
Exactly.
Okay, so if you are losing hair, it happens. We get older, men and women. You can request a consultation to come here to Destin Plastic Surgery. You can talk with Dr. Ennis, and the number is on your screen right now. Just give them a call and come on down.